To stop losing weight once you reach goal. We'll also talk about when a stall is way too long, and we'll also talk about what to do before surgery. Hello everyone, I'm Dr. Alvarez from Endobariatric.com and welcome to episode 64 of the AskDrA show. Thank you so much for the questions this week. Really good questions, by the way. And I want to invite you, my listener, my subscriber, that if you've never submitted a question, to the AskDrA show, you're welcome to do so. I want to hear from you. Don't forget to use the hashtag AskDrA, or if you want to send it over through my phone, through Snapchat, you're more than welcome to do so. All right, so let's get into the show.
Once you reach your weight loss goals, how do you stop losing weight?
All right, so it's not a very frequent question that you get, like, what am I going to do once I reach goal? It's normally a pre-op question from a patient that's looking into the sleeve and is thinking, well, once I reach goal, what do I supposed to do, or how does my body know that I've reached goal and not to lose too much weight? It doesn't work like that. Remember, and the patients that are listening to me right here, you know that the sleeve will advance, and it will advance really quick the first few months to 12 months to a year. But the more weight you lose and the less weight you need to lose down the road, the less weight you have to lose, it will go down slower because your body metabolizes slower, because your body doesn't have enough weight. That way your body burns less calories because you don't have to move that much mass around. So your body weighs less and you burn less calories. So you'll have really fast weight loss right away because it'll kickstart your metabolism, it'll get going, but as you progress, the weight loss starts to come down because you don't have much weight to lose down the road. So it starts to slow down, and when you have a few pounds left to get to goal, it all of a sudden starts to stall, and you know this. But patients, as being a pre-op patient, start to think, well, if it's calibrated to a certain size, it'll go to goal. What does it prevent? How does it prevent me to go overboard? Now, it doesn't work that way. Remember that the sleeve is a portion of stomach. You are calibrated. It does not, surgeon doesn't go, well, I'll just cut here and here and here and here, and that should work, and that should make the magic. No, it's a calibrated sleeve. It's a calibration that we use during surgery to leave that stomach a certain size that will be enough to get you the vast majority of the weight you're carrying, overweight, will make it go away. So remember that the sleeve is a tool. You need to work with it. The sleeve will not be calibrated like a dial to see, let's say it's John's surgery, and I can't go inside his tummy and just dial it down to John's goal weight. It doesn't work that way. So you'll have to do a little bit of effort. You'll have to work with your sleeve, do a little bit of exercise, and it doesn't go like getting to goal and going overboard. It doesn't happen that way.
How long is too long of a stall?
All right, so talking about stalls, and I have quite a few videos on weight stalls. If you want to go to those videos on YouTube, weight stalls with a gastric sleeve. Weight stalls are normal, so you need to understand they are needed to the body, needed for that body to adjust to the new you, to the new size, to the new everything, to your new weight, to your new amount of fluid in your body, to the amount of your body metabolizes everything, to the amount, even to the amount of blood in your bloodstream. Everything changes depending on your weight. So your body puts on that emergency brake on, hits a stall. It's intended, needed. And then your body adjusts, and then that's when patients notice they start losing sizes. And once you get to that, it'll start going again with the weight loss. All right, so how long is too long for a stall? It depends on everybody. There's no exact number. I can't tell you 5 weeks. I can't tell you 4 weeks. I can't tell you 1 week, because Imagine yourself, let's go back to the first initial question talking about once you hit goal. Maybe you are already at goal and you still want more. You still want to lose 5, 10 pounds, 15 more pounds, but your body, or with your BMI, your height and weight, you're at goal. You're at a good, healthy zone. And you're saying, damn, I'm at a stall. But it's your stall here, but your body is really good and comfortable at that weight, and you've hit goal weight at a good BMI and a good healthy zone. So how about you're a little overweight before getting to goal? You're 15, 20 pounds and you hit a stall, and you've just been there for months. So that means that the sleeve did its part. You'll have to put in a lot of effort now, because going back to the first question, you don't have much weight to lose now, and now it'll be punching that effort big time to be able to lose those extra few pounds that you have left. But in your mind, you have that stall. I'm at a stall and I just can't move that number in the scale. Well, now is a sign for you to say, well, now you got to put more effort. Now you got to put more of seeing what your choices on food, what you're eating, what time you're eating, if you're skipping meals, if you're exercising, your activity levels. All these issues come into play for those last few pounds. So it's a relative question, but it's a relative answer.
Any recommendations on things I should be doing to prepare before surgery?
All right, so what to do to prepare for surgery? Number one, follow your surgeon's guidelines. And like in our practice, we have everything for you. We have a shopping list for things to have at home once you get back from surgery. You've got things to do before surgery. You've got things what to bring for surgery. Everything is already set up for my patients. But number one is follow your surgeon's guidelines. Probably the most important thing, probably the best advice I can give you is to follow the pre-op diet to the T. Pre-op diet, your surgeon's guidelines again, vary, and they vary from days to a week or a couple of weeks, and it depends on BMIs, body mass index, the amount that we're expecting to have that fatty liver, and we need to shrink that liver. That's the most important thing. But then comes other things that, let's say you need an EKG, let's say you need a chest x-ray before coming, let's say you need a stress test before coming, let's say you see, all these things are things to do to prepare for surgery, but vast majority of the patients don't need all this. It's a very particular case, and that's why well, at least I do in my practice, I screen out every single patient that comes to us. I go over their health histories. I recommend what needs to be done and what doesn't to every particular patient that submits a questionnaire with us. All right, so take home message, follow your doctor's orders. All right, so that's it for episode 64. Question of the week is, how long have you had a stall for? What's the longest time you've had a stall for? Answers below. I want to hear from you, and I know you're going to be interested in seeing the comments below too. Don't forget to subscribe. Bing, 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 bing. Subscribe button. That way you don't miss any of the AskDrA shows in the future. I'm Dr. Alvarez from endobariatric.com, and I'll see you in the next episode.